Hey guys, Coach Joe and Coach Shaw again bringing you part 2 of our deadlift series, talking about breathing and proper tension in the deadlift. So one of the big things that we have to establish in the deadlift before we get any type of movement is proper tension. Before we can be mobile, we first have to be stable and tight and tense on the bar. So the first thing that we're going to do to address that is proper breathing, making sure that we have enough air and proper tension within the core. So when we're talking about breathing, we're not talking about taking a big breath into the chest here, we're talking about taking a big breath into the belly, okay? So when we do that, we want to fill up the abdominal cavity with air and brace down there. Now we've got that intra-abdominal pressure. This is basically our body's way of creating its own belt, okay? So Coach Shaw, he's going to take that deep breath in and he's going to brace right before he moves on the barbell. Okay, so he can take his breath in from the bottom, big breath, and now he's in position to be able to pull. Now, as far as tension, the big thing that we want to address is how we actually get into proper position. What we don't want is to just be able to drop down into position. It looks good, but we're nice and loose and we don't have tension. What we want is to be able to use the weight of the bar to pull ourselves down into proper position. Now we have that air, everything is nice and tense. When he pulls himself up, he's doing a good job of showing it, but actually with this weight that's on the bar, when Coach Shaw pulls himself back into position, this bar should actually lift off the ground before he's actually started to pushing. That's what kind of tension that we're talking about that we need to have established before we even start the deadlift. So in part 1, we covered our foot position, our hand position, proper positioning. Part 2, now we're bringing together the breathing and the tension that we need before we start the actual movement, which we'll cover in part 3.